Hi, and welcome to my video on how I reversed my heart disease using no special diets, no special foods, or no change in lifestyle. Now, these things are helpful and important, but they really are not necessary, in my opinion, to get rid of heart disease. I first took IV chelation for about 20 years, which was a bag of IV solution to which they added several supporting vitamins and minerals and stuff to the main ingredient, which was calcium disodium EDTA. EDTA stands for ethylene diamine tetraacetic acid. Again, ethylene diamine tetraacetic acid. Big word. That's why we call it EDTA. Since then, the chelation doctor I was going to passed away, and his practice closed down. So I did without chelation treatments for about 2 years, until I discovered a way to effectively administer my own IV chelation substitute that I could do at home all by myself. Now, I have heard and tried chelation pills, and they just did not work for me, or others that I knew that had also tried it. Our chelation doctor explained to us that the reason they did not work is that the acid in the stomach destroyed 90% of it before it could be utilized, which made it pretty much useless. Now, there are two other doctors in my area that do IV chelation, but they are just too expensive to get started with due to a required $250 office visit and then more costs for blood tests, plus $175 cost for the IV chelation itself. So the first treatment would have cost me $500 to $600, which I really did not have. I was more used to paying only about $100 for an IV treatment and then only about once a month or so. Now it only costs me about 50 cents for the same results. After being tested with a mild plaque buildup in my arteries, I knew I had to do something. So I began looking for other ways. And then I suddenly thought of how they tell heart patients to put a nitroglycerin tablet underneath their tongue so that it is immediately absorbed into the bloodstream to expand the blood vessels that support blood to the heart. I thought, wow, if the nitroglycerin could be absorbed directly into the bloodstream by putting it underneath your tongue, then, well, why couldn't I do the same thing with the contents of an EDTA capsule? Of course, at the same time, being careful not to absorb it too quickly or too much. Well, it worked, as evidenced by another test that showed no detectable plaque. A normal chelation solution is about 2 or 3 grams of EDTA, along with the other stuff they put in with it, vitamins and minerals, and it's stripped into the bloodstream over 3 hours or 180 minutes, which comes out to about 45 minutes for a 500 milligram tablet. So I take about 1/4 of a tablet every 10 minutes or so and put it underneath my tongue and let it dissolve and absorb, which it does very quickly. Sometimes it's a half an hour or more in between the doses if I'm distracted. I do not think that really matters, except to not take too much too fast, because all of the heavy metals and plaque buildup has to go through the kidneys. So this is why I only take one 500 milligram tablet a day for a maximum of 3 or 4 times a week. Or when my arteries are cleaned out, I do it just once a week or two to keep the arteries clean. I also drink water at the time to help flush out the kidneys. A normal IV chelation is only done under a doctor's care once a week or a maximum of 2 times a week in a case of a dangerous buildup, and then only for a couple weeks. It took about 12 treatments for my arteries to clean up, but for others, it could take twice as long. And then you just take it once a month after that to keep the arteries clean. Since chelation strips out the good essential minerals along with the bad ones, it should only be in combination with oral high doses of multivitamins and minerals, because side effects due to vitamin and mineral deficiencies may occur. How do I test for the progress? I monitor by using an ultrasound. I find it difficult to get my doctor to authorize an ultrasound with no particular medical urgency, so I just have it done myself because having an ultrasound does not require a doctor's approval, and they are usually not much over $100. I used Lifeline Screening, which is lifelinescreening.com, which charged $70 at the time, and they are a traveling testing group that is available in most U.S. states. Of course, doctors send a report later on. There are also ultrasounds most anywhere in the world. Chelation simply means to grab a hold of and extract. It was first used by the Germans during the World War II era to treat lead poisoning, which was also found to get rid of other heavy metals like iron and copper and mercury and aluminum and zinc, and later used for other conditions such as cardiovascular disease, diabetes, autism, Alzheimer's, and leg pain due to poor and obstructive circulation. Most doctors will tell you that chelation does not work, except for maybe the lead poisoning. But I have met hundreds of people that it has worked for, including the most extreme case I have ever seen of a woman that came into the treatment room in a wheelchair and was 90% blind from diabetes. Her previous doctor gave her 2 months to live and told her to go home and take care of her personal affairs because there was nothing else left that he could do. I ran across her again about 15 years later, and she was out of the wheelchair and was reading fluently without glasses. And she had some choice words about the doctor that gave up on her and told her to go home and prepare to die. If it was not for her husband refusing to give up on her and finding out about chelation, it would have turned out much different. There are some cautions and side effects to consider, and pregnant women, children, people with certain conditions are advised not to use chelation. I also urge anyone to consult and be monitored by a medical professional before trying any type of controversial chelation. I hope this video helped you, and I hope that you liked it enough to subscribe, as subscribing would be a big help to us, so you'll be able to easily find my other upcoming videos on helpful subjects. And don't forget to click on the thumbs up if you liked the video, and thanks for watching.